You're listening to Happy Healthy Hormones with Dr. Chris. Are you tired of the short-term patch to your health problems? Is avoiding medications and surgeries important to you? If you answered yes, then your prayers have been answered. Dr. Chris has been helping people transform their health for over a decade. He's a world-renowned health expert who specializes in holistic health. He's a professional speaker, chiropractor, and international best-selling author. It's his mission to help you reach your full God-given potential through holistic health and healing. Get ready to be inspired and transformed. Here's your host, Dr. Chris.
Today's guest is Dr. Robert Silverman. He is a doctor of chiropractic, clinical nutritionist, national and international speaker. He's the author of Amazon's #1 bestseller, Inside Out Health, and founder and CEO of Westchester Integrative Health Center. The ACA Sports Council named Dr. Silverman Sports Chiropractor of the Year in 2015. He is on the advisory board of Functional Medicine University and a diplomat with the American Clinical Board of Nutrition and a diplomat with the Chiropractic Board of Clinical Nutrition. And Dr. Silverman is a seasoned health and wellness expert. In fact, he has so many other certifications, I didn't even have time to list them all out. And today, we're going to be talking to Dr. Rob about brain health. Specifically, he is an expert in this field. He has helped people with concussions and other brain health issues. So let's hear from Dr. Rob. Hello, everyone, and welcome. We've got Dr. Rob Silverman here with us today. So he is just the man. He has so many credentials behind his name. I think they ran out of letters in the alphabet to be able to give him more more credentials behind his name. So he's a genius guy. We had the privilege of being able to have him on today. So Dr. Rob, man, thanks for being on the show today.
Oh, thanks for having me, Dr. Chris. I really appreciate it. I'm excited.
No, absolutely. You know, I want our viewers to get an understanding about your story and how your life brought you to where you are now in helping so many people in a really integrative approach. So share that story with us, please.
You know, it's real funny. I became a chiropractor because I have a physical ailment. I have what we call congenital torticollis. So I was helped by a chiropractor. He kind of changed my life around. They gave me belief that I could get help and I could continue. And, you know, and I decided then at 21 when I got off the table that I wanted to be a chiropractor. So I went to chiropractic school. You know, I finished up with my business degree, got a job at IBM, and just quit day one and went to chiro school. So, you know, I'm being a chiro and it's great. You're helping people musculoskeletally, all sorts of things. And you start integrating nutrition and you start doing weight loss. And then you realize with the nutrition or the biochemical aspect of chiropractic, you really got to get into the functional medicine, functional nutrition, and diagnosis. Mm-hmm. So to get that clinical outcome, I was a big believer, and now I'm a big proponent of taking the mechanical, which is very chiropractic, and the chemical, which is a little bit more nutrition, integrating the two to get clinical outcome, performance, and just health.
Absolutely. That's great. So you actually had a job in IBM, and then you're just like, no, I'm out of here. Not my calling. Is that what?
Yeah, I'll be very frank. What happened was I graduated school. I got my job offer from IBM. I knew in my last year I wanted to be a chiropractor. Got a lot of kickback from my parents. Got the job in the morning, said, you know what, I'll give it a shot. And all I did and all I saw was people who were talking about when they were retiring. And I was like, my God, I'm not going to retire. There's no retiring when you have a mission. There's retiring when you have a vocation. And then when they started to show me the watch that they got, to this day, and you can see it, I don't wear a watch because I know what time it is and I don't want to know when I'm going to retire because I'm not done.
That's so key. You know, it's funny in our culture how we've built up this huge, just put on a pedestal, this word retirement. And when you look at really what that means, if you're really going to retire, it's like an early death is really what that means. So if you want an early death, you actually retire versus what you're doing, which is just continue to have a purpose, a mission. And maybe at some point that means your mission is not different, but maybe it's toned back or you're doing other things or your mission changes, but it's like you're still on a mission till the very end.
I agree. I mean, my dad's 87 and a half and he still goes to work. And all his friends say, you know, when are you going to retire? He goes, I'm not ready to pass on. If he has a passion to do what he does. Yeah. And that's the same. And I learned that from him. And that's the same thing here. Money's a side effect of helping people. So sometimes you don't get side effects, and that's okay. It's all about the mission. And you know what? I was helped, and you just hope that the people that you help, they're your opus, if you will.
Absolutely. That's great. Well, and I really, one of the reasons I brought you on here too, because you're such a wealth of knowledge, but especially when it comes to concussions. I actually heard you talk at a seminar. It was probably about 6 months ago. And just the things you were talking about, it was really transforming. It really just put more light on people. And I feel more people need to understand this because there's so much buzz around concussions and brain health, and obviously how your brain health just influences every other part of your body, chemically, emotionally, spiritually. And a lot of people don't really understand the significance, I think, of what's going on with brain health. And now we're seeing people getting diagnosed with things like Alzheimer's in their 40s, and it's just getting crazy out there. And so what brought you to take a deeper look into concussions and that aspect of brain health?
You know, the concussion was interesting in that there were so many people that were coming in my office suffering from a concussion, athletes and others alike. And I didn't have any answers, and there was nobody to go to. So almost out of a necessity to continue on my mission, I started to investigate, treat, and get protocols together for concussion. So mine is based on whatever literature I could go to, which at the time was nothing. 5 years ago, there was no conversation about concussion. It was hush-hush. It was, the old boys club. We don't hear no evil, see no evil, we don't speak no evil. So now, fortunately for us, the literature started to come in, and a lot of it's empirical, which was great. And now you see a real platform for discussion of concussion. Until this day, in the area that I'm in, which is right outside New York City, I'm the only guy that really treats concussion. Nobody's still done it. It's crazy. Yeah, they'll tell you that you have a concussion, which is one aspect. By the way, when it comes to concussion, there are a tremendous amount of tests you can do. And I'm sure as we go along on the podcast, we can go into more detail on what to do and what blood tests and everything.
Absolutely, absolutely. And so why are concussions, especially, you see it highlighted in sports so much, but obviously you can get a concussion in any avenue of your life, but it's definitely more prone because there's a lot of high-impact sports out there. Why is that becoming such a big topic in our culture?
Well, I think it's a big topic because now it's at the top of everybody's conversation list because we know that it exists. But when you really think about the idea of your brain, which is 3 pounds made out of the consistency of Jell-O. So everybody for a moment just think about Jell-O, soft Jell-O, moving around in the hardest bone in your body. It doesn't necessarily have to. I hope you can hear this hit. If you just whip back and forth. Take Jell-O and whip it fast enough at enough of a gravitational force, and it will start to tear. That is a concussion. So with that being said, the problem with that is that a lot of the symptoms are early, but some of the key symptoms, like the tearing of the insulation of a nerve, which is the myelin sheath, that usually occurs in 2 weeks after a concussion. Whereas most people's symptomology or testing symptomology allows them to go back to their sport in a week. So now you've got this unfortunate panacea of someone going back with an acute concussion, but the symptomology isn't showing, and a week later, that myelin sheath opens up, and it takes 2 weeks to 2 months to get that myelin sheath to heal. So without question, everybody's at the opportunity to have a second concussion and so forth. In addition, our particular population is more susceptible to concussion because of the current, what I'll say, health place. Their guts aren't as healthy as ours because of all the toxins. Their livers aren't as healthy, again, because of all the toxins, the increase in gluten, the increase in sugar consumption, etc. So once you get a concussion, you're more susceptible to another concussion. And finally, the last thing is so many more women are playing sports through Title IX. What's happened is women are actually a hotbed for concussion. They're twice as accessible to get a concussion, and they take twice as long.
That's crazy because there's probably, when I was playing sports in high school and to college, when you got a concussion, worst case scenario, you'd be maybe out for a week. And then, but you're saying now 2 weeks to 2 months is when you can have the other effects of that, and it's still happening. I mean, man, no wonder so many people are having so many issues out there. And then fast forward years later, they're having all these symptoms that they don't even relate to a concussion, right? So like, what are some of the long-term effects you're seeing with your patients with concussions? Maybe the ones that they're having, like 2 to 4 months, but maybe the people that you trace it back to years back. What are you seeing in those people?
Well, what's really interesting about a concussion, and a great case study would be had a patient come in with psoriasis. So psoriasis is a byproduct of autoimmunity from gut dysfunction, or leaky gut, if you will. Mm-hmm. Your gut is 80% of your immune cells. It's where your macro and micronutrients are absorbed. When you hit your head, like in a concussion, it is connected to your gut. So your gut and your brain are bidirectional. So when you hit your head, you have gut issues. So from that concussion, they ultimately had leaky gut. Leaky gut caused autoimmunity. Psoriasis was the end product, but the cause was concussion. We went in and we tested and didn't only have leaky gut, they had post-concussion symptomology. Patients have walked in post-concussion 3-4 years later, and all of a sudden, I got celiac a year ago. So one of the biggest takeaways, if any takeaway, is everybody thinks a concussion is just from the eyebrows up. Mm-hmm. It's actually from the top of the skull all the way down to your waistline, and truly the whole body. It's your window in to the gastrointestinal system, and there's a lot of reasons why that occurs.
So how many years past a concussion can you still have what you call like those post-concussional symptoms? Is it 3 to 4 years? Can you see those going 10, 20 years? How often can you track those?
I've had patients come in and talk. They're older than me, and I'm in my 50s, and they're talking about concussions that they got in college. And we're finding out that they were perfectly healthy at 21, and they have a lot of gastrointestinal upset. They've had memory loss, advanced memory loss. And yet when we put them on a protocol, the protocol that I put together, we found that they've been able to recoup. So the beautiful thing about the brain is the brain allows now for what we call brain neurogenesis. Nerves can grow back. Mm-hmm. So people shouldn't be, oh no, well, it's too late. It's never too late. There's always the ability to help healing. And also the biggest thing is to stop the degeneration. Mm-hmm. So if I told you if you're 40 and I said, whatever I do for you in the next month is going to stop degeneration for 10 years, that's a win.
Well, it's huge. I mean, when you have somebody who is, let's say they're 40s, 50s, 60s, even in their 70s, and maybe they're having these issues, but hey, if you could maintain even the quality of life now in the next 20 years, that's a win for 95% of the population, I feel. So if you can catch it early, that's cool.
Absolutely.
Now, a lot of times we think of, I think in our culture, concussions being a young person problem, right? Because people are maybe more inclined to play sports and the contact sports when they're younger. But what can we do? And that's probably and just like with any aspect of your health, it's so much easier to prevent something than try to overcome a disease. So what are some things that parents can do to even protect their kids now from either one, getting the concussion in the first place, or two, making sure they can recover from a concussion if they do suffer from those things?
Well, my suggestion, and this is based on data, based in JAMA and articles of that, they've said if you want to embark on football, do not start tackling until after 12. So that's one thing. Number two, if you're playing soccer, learn how to strike with your head later, especially women. So those are a couple of things. There are new helmets that are being made. So you can have these specially made helmets that have a little bit more padding. Actually, if you play hockey, they're padding the shoulder pads, because in hockey, the number one concussion is a shoulder to head. So they found if they put a little round piece of foam, they decrease the amount of concussions by 25%. That would be number one. Number two, fish oils for everybody. Mm-hmm. Fish oils are a great choice. EPA and DHA, omega-3 fatty acids, they're a great choice for post-concussion syndrome, and they help resolve a lot of those symptomologies and help heal the cell membrane and neurons, etc. They're even better before. So you're a practitioner like me. If you have kids that are coming in that are playing collision contact sports, give them fish oils. They get a health benefit anyway, but it's a great brain benefit. Stay away from gluten. Gluten means glue. It sticks in your intestinal tract. The average American consumes 146 pounds of this crap. It sticks in your gut. Grain Brain, David Perlmutter, said in 2013, gluten damages the gut. Now he says he doesn't even ask that. He knows that. He's testing for the damage that it does to the brain barrier because the brain barrier is made up of the same proteins as the gut. No gluten, no sugar. Sugar is a toxin. And everybody, you know what? You and I and everybody spend about 1/3 of their time on a mattress. You and I are fortunate that we can sell to the population with a doctor's note a non-flame retardant mattress. They actually have to get to the doctor's note to sleep on a mattress that is healthy.
That's crazy, right?
That's nuts. You need a doctor's note to be healthy. You're supposed to have a doctor's note when you're unhealthy and you can't do something. Yet we need a note from us. So I bring that up as something that's shocking. Guess what? I'll give you a little easy one. People say something every day. Stop chewing gum. Gum is a huge molecule that's indigestible. So even if you chew it and you don't swallow it, the particles break down. They can't be broken down. They stick to your gut. They damage your gut. Stuff as simple as that. We can go on and on and on.
Wow. I mean, there's so many things. And I think it's important for people to understand that, hey, you don't have to hide from everything. But if you can have a game plan and you do a couple of things that are really right, it's going to go a long way. Like with the omega-3s, so important. Couldn't agree with you more. What is your recommendation for our viewers out there that are wondering, okay, what should they be giving either their kids or themselves as just a maintenance? And then also, too, if they do have some kind of brain trauma, what should that dosage go up to?
Well, for maintenance, it's a real easy thing. EPA DHA is about 2 to 4 grams if you've never taken it before. So usually I recommend 4 grams for a 3-month period. If you've done the 3-month period, 4 grams per day, you then can go down to 1 to 2 grams. If you get a concussion, you're looking at 8 to 12 grams.
Wow.
8 to 12 grams of EPA DHA. You said, wow, because we all think that it's a high dose. It sounds like a high dose, and everybody's fear is fish oils do what? Cause bleeding. No article, there's one article, I'll be correct. One article that says it causes bleeding, and guess what they mix the fish oil with? Aspirin.
Oh, yeah.
There was a study that just came out that fish oils cause no post-surgical bleeding.
Yeah, there's so many myths out there, right? I mean, when it comes to health, there's the myth of that medical model, which is just really just medications and surgeries and patches. And then they've created so many myths around holistic health and really what that's about as well. So that's perfect clarity. Thanks for sharing that as well. And then, so what are you doing to help people that have been affected by concussions? What really sets you apart that helps these people so much?
So post-concussion, we have a 5-part protocol. Number one, we look at the musculoskeletal system. You're a chiropractor, I'm a chiropractor. There is nobody better than a chiropractor to treat the particular concussion. That's after they've been diagnosed. So the musculoskeletal system, great. Look at the occipital ridge. Look at the occipital triangle. The rectus caput posterior minor has the most parallel fibers. It has the biggest myodural ridge. It's a great muscle to work on. So obviously COC1 comes in. C-spine. So many people forgot about the C-spine. Look at the C-spine. It's been implicated in a lot of concussions. So you want to manually check it. And we found that work on the C-spine both through assessment and manipulations are a critical element for clinically good outcomes from concussions. Number 2, balance training or proprioception. Your balance in space, where you are, your balance between your nervous system and your muscular system. So balance training can be as simply standing on one leg, using some unstable surfaces, rocker and wobble boards. The key, one of the biggest assessments to a concussion is to look in the eyes. The vestibular oculomotor screen is the number one screen. It's a 4-page screen. If you listen to Ted Carrick, who is the god of functional neurology, he's a brilliant man. He does all head-eye movements now. And that's a critical element. When you can coordinate those movements, you're now on a path of getting better. So that's vestibular type things. 4, laser. I'm a big proponent, and I will be very clear on the laser. It's a non-thermal laser for the brain. All laser light is positive, but non-thermal laser is critical for applying to the head because you don't want any heating to occur. 635 nanometer red light is without question your choice. In addition to that, all the literature speaks to that, of really having a resolution because of the light. The laser light, it stimulates healing at a cellular level. Something that I've patented is a vagus nerve stimulation through a different laser light, which is a violet light, because your vagus nerve is your bidirectional communication between your head and your gut. So what happens is when you have a concussion, your sympathetic nervous system, fight or flight system, turns up, your parasympathetic system goes down. Your parasympathetic nervous system is headed by the vagus nerve. It's your rest and digest nerve. So that's part of the reason when you get a real headache, you're going to have a lot of gastrointestinal issues and small intestinal bacteria overgrowths and throw up. How many people said, I throw up? Because their vagus nerve goes down. So we do with that a vagus nerve stimulation, and then a very complete up to 15 different nutrients for concussion, and in different stages: acute, chronic, subacute, prevention, wellness, and the like.
That's awesome. So much knowledge there. And, for people that are, maybe they haven't had a concussion, or maybe they did and they didn't realize they did back in the day. I mean, you probably interview, 10 people that played a sport. Probably, I feel 9 out of 10 are going to tell you they never had a concussion, but really they did at some point, from the compaction of whatever they were doing. But what can people do to just, one thing maybe they could do to protect their brain health? Even if they haven't had a concussion, they're just worried about the Alzheimer's, the dementia from, like you said, the toxins, the things we're exposed to. Is there an app out there that you recommend for people, or is there something like stimulus? Is it as simple as reading a book every night? What is one thing you think that could just help protect the brain the most?
Well, I'll say to protect against the physicality of a concussion, neck strength. They should be increased. So when it comes to us, we could do a lot of flexor work. And I think that's lost with a lot of the active rehab that we do in chiropractic. I think it's something that I know you and I talk about, you and I love to do. So get some neck strength, neck girth, neck strength, and posture. Better posture, less of a chance. So they won't be able to see me. But to think of somebody whose head's perched forward, in a boxing match, they're going to get clipped on the chin. They stand straight up and they hide, and their posture is better. You're not going to have that same. So that's something that you can do. As far as the nutrition we talked about, eat healthy, sleep, keep your body in just a basic lifestyle. Basics. We're all about personalized lifestyle.
Yeah. Let's get back to those foundations and just allowing our body to do what it does best, which is heal. We just need no interference with that process, right? That's amazing. Now, I want to touch on one thing with you, which is, this is totally off topic, but I'm really interested in this, is one of your certifications. Like I said, the list of your certifications is amazing. Hard style kettlebells. Certified in hard. What is that exactly, and how did you get certified in hard style kettlebells?
Well, I wanted to do the kettlebell because I wanted to learn some stuff from Pavel, or disciples of Pavel. So he is the kettlebell guru. And what I liked about the hard style was that I can get my wife to go with me, and it's rare that she'll come to a seminar with me. But what I liked about the hard style through RKC was it did the Turkish get-up. And that is a great movement screen. That's a great movement screen for athletes. So we have all the functional movement screens, and I've done that, and the selective functional movement assessments and everything of that nature. And they're all very good. They all have their place. But you know what? Put them in a Turkish get-up, and it will reveal so many things. And that's a great exercise you can do in your hotel room on the row. So I love that. It did a swing, and the swing is a great overall move. It was also a great move to test your lumbar spine and shearing, and it mimicked hip hinge. So I really wanted to learn it because I want all my patients to move into hip hinge and not bend at the lumbar spine. They kicked in a squat, which was a goblet squat, a frontal squat. And so I just love the movements. I love the concept, and I wanted to learn more about it. And I think kettlebells are a great option or addition to anybody's exercise armamentarium.
Oh yeah, love those for sure. So those of you that don't know what he's talking about, go out on YouTube. I'm sure there's a ton of kettlebell movements out there. And Doc, what are you working on right now that you're just excited to help people with, so that our viewers can even reach out to you if they need help with some of these more advanced neurological problems?
Well, right now I'm working on, of course, some more advanced moves within concussion in the vagus nerve, and a lot of what we call the functional medicine. So I hate the word functional medicine. I used it. I like functional nutrition, a personalized lifestyle. So I think too many models have people looking at symptoms and not looking at systems.
Mm-hmm.
So when you look at symptoms and not systems, you are just basically putting a Band-Aid on a bullet wound. When you start to look at systems, then you realize getting to the system may enable you to get to root cause resolution. So my goal was to enable myself at one point to look in the mirror at the patient and give a reflection of where they are now. Now my next goal is to be able to change that reflection. So I'm going to be adding some cupping, to help with the fascial stimulation, non-bruising cupping.
Mm-hmm.
And I'm working on my second book. So my second book, surprisingly enough, is going to be all about the gut-to-brain axis and health and disease. That's the name of it. That's the theme. We've got a working title right now. So I'm excited about that, national blogs, and sharing this social media network with you.
Absolutely. What's like one main area they could come and just visit you, find you online? What's a good website or like a platform?
My website is DrRobertSilverman. My Facebook and Instagram are DrRobertSilverman. We post 2 to 3 times a day. We have Facebook Lives. Got a webcast, which we're going to get you on, which is called Proven Health Alternatives. So they have ample things to reach out. Email me. No problem. I will answer that email within 24 hours personally.
Cool. We'll put all those links on the back end here on the website and on the podcast for sure. So you guys that are listening can all get that access to Dr. Silverman as well. And Doc, I just will finish up with one last question here. You can do this in 30 to 60 seconds if you can. What does reaching your fullest potential mean to you?
Is that personally, or is that for my patient in front of me?
That is whatever that means to you. I always like to ask that question to every single one of my people I interview.
I think reaching the fullest potential to me is optimizing yours and all your patients' health by pushing them to their genetic limits.
Mm. That's awesome.
No boundaries. Stretch that envelope as far as you can. Just don't break it.
I love it. Awesome, Doc. Well, hey, we appreciate you having you on today. You've just really opened up a really great topic and getting some information that they need. Because like you said, there hasn't been a whole lot of information and resources on that. Hopefully you guys can take something away from today and start to apply those things and get more information. Get on Dr. Rob's email list or his webcast, whatever, so that you can get that new book that's coming out, because I'm sure that'll be a bunch of knowledge dropped as well. So thanks, Doc. I appreciate you.
Always a pleasure. You do a great job. Keep it up, man. See you soon.
Thanks for listening, and we hope you enjoyed today's episode. Please help more people in reaching their fullest potential and rate, review, and subscribe to this podcast. For show notes and other free resources we mentioned today, go to newedgewellness.com.